Hello and welcome to the Wake Up Call podcast. Today we are speaking with Dr. Bob Murphy about U.S. government interventions in healthcare, Obamacare, and the problems with single-payer systems. Dr. Murphy is a research assistant professor at the Free Market Institute at Texas Tech University, a research fellow at the Independent Institute, and an associated scholar with the Mises Institute. He's the author of several books, including his most recent book, Choice, Cooperation, Enterprise, and Human Action. And particularly relevant for today's topic, he is a co-author of the Primal Prescription, Surviving the Sick Care Sinkhole. He is a co-host of the Contra Krugman podcast, which you can find at contrakrugman.com, with Contra spelled with a C, and you can follow his work at consultingbyrpm.com. He's on Twitter at BobMurphyEcon and on Facebook under the name Robert Murphy. For more information, see the show notes page for this episode at wakeupcallpodcast.com/healthcare. Dr. Murphy, welcome to the show.
Thanks for having me, guys. Glad to be here.
Well, sure. It's great having you here. So we'll get into some of the pre-Obamacare government interventions into the healthcare system in a bit here. But first, can you give us a sense of what the healthcare system, or to the extent that there even was a system, looked like before government interventions and before even the 20th century?
Well, sure. So historically, it was just a system of a provider of medical services, and the patient was the customer. And so, of course, way back historically, the medical science itself wasn't that advanced, and so that was the shortcoming. But as far as the relationship between the doctor and the patient, I think that was, the proper one. That there was a sort of a fiduciary and a care responsibility, and the patient was calling the shots. And if the patient didn't like the service that he or she was getting, then they would fire the doctor and move on. So that was, the incentives were all lined up, and that has changed fundamentally starting in the 20th century primarily. So I think that change is one of the ones that has really driven a lot of what the public's dissatisfaction with healthcare delivery has been. And then also, as far as training goes, like, how does a person become a trained medical doctor? Again, the historic model was one of like a master-apprentice relationship where newcomers would go seek out the existing experts and would work under them, study their techniques, and then gradually be instructed and come up through the ranks that way. And that also has been largely replaced by a more institutionalized framework with government certification and so on, and third parties getting involved and saying who's allowed to practice medicine.
About when did that era begin of the institutionalization of healthcare?
Well, we go through some specifics in the book, but I think in the late 1800s you can start to see, at various levels, at the state level, certain people coming in and putting in things in place. So it was not just like overnight one thing happened or the other, but late basically the progressive era, when so many changes happened in the United States in general. I think that's when you really start to see moves to really regulate and to start making things mandatory.
Okay, so can you go into some specifics about some of those moves to make things mandatory and some of the interventions into the healthcare system at that point?
Well, sure. So like a big example would be in 1910, there was what was called the Flexner Report of the Carnegie Foundation. And so he went through and looked at medical education in the U.S. and Canada, and made a recommendation. I'm just looking through the book here. Made a recommendation of minimum admission standards, including at least 2 years of university education, things of that nature. And so that was like one good example. So again, that was 1910 when that happened. So at this point, it wasn't being totally mandated, but that was an example of a marker in terms of historical standards. And so we can see, let me just give you another statistic here, that earlier, by about 1900, for example, there was 175 physicians per 100,000 of the population. And then by 1930, that had dropped from 175 down to 125. And during the same period, more than 30 medical schools closed. All right. And so that's, again, you would think it'd be the other way around, that over time, as more people would be going into medicine as it became more advanced, but it was the opposite, that there were fewer doctors per capita, and the absolute number of medical schools declined from that point forward. And that was, again, because of increasing restrictions and so on, that various institutions were not allowed just to be training people in medical science, and you started needing more and more official stamps of approval from the state legislatures.
So very much like farming, where there's fewer and fewer farmers over time, all still feeding everyone.
I mean, yes, it is that pattern, but I think in farming, well, again, it's hard because there's a lot of intervention in farming too. With those things, it's hard to know, what's the mark of genuine improvements in the efficiency of delivery versus, what is just the fact of artificial supply restrictions. So I mean, you're right. I mean, both things were happening simultaneously. And so you do have the anecdotes of doctors making house calls, in the 1920s and so on, early depression. There is that, and that was true. That's not just a myth that doctors would do that. So on the one hand, that sounds great and quaint, and isn't that nice? But on the other hand, you think, well, if these are really highly trained medical professionals, do we really want them wasting valuable time in transit going to patients? Wouldn't it make more sense to bring the patients to them? So yes, there are examples of that where you would need fewer doctors per capita if it were legitimately the result of just improvements in efficiency. But I do think a lot of this was a sort of crackdown on what people would have called quack medicine, the people who were disparaging it. But some might say, well, no, these are just alternatives like homeopathy and things like that fell on the wrong side of the political struggles and what was considered to be legitimate medical practice versus, stuff that is dangerous to the public, and we're not going to not allow, either not endorse it or even prohibit it, depending as to the severity of the regulation.
How did health insurance work back then, and how did it kind of morph into what it is today?
So again, a big topic, just some of the broad strokes. So originally, health insurance was more of the form of like catastrophic insurance. Just like if you think, forget about medical care for a minute, just like how does car insurance work? If you get into a bad accident, you total your car, well then the car insurance, your policy kicks in, and they, as long as you kept your premium, you paid your premium and so on, you get the indemnification. You'd be able to go buy a new car of this, the same value as what you had that got destroyed in the accident. But if you go get oil changes or things, you wouldn't send that in to your car insurance company to pay half of the cost of your oil change, right? It's just standard maintenance and preventive care, if you will, for your vehicle. That's not what insurance is for. So health insurance, to the extent it existed, back in the day, that's the form that it took. And then what happened in the Great Depression is when we saw a really big leap in this, is because what would happen is, obviously the economy was so awful, people were still sick though, and so doctors felt morally and in terms of their practice, professionally compelled to still administer care to people who needed it, regardless of their ability to pay. And so doctors and hospitals kind of got together and said, what are we going to do about this? And so they hit upon the idea, if we could get if we could increase the amount of insurance, health insurance that the community has, increase coverage, then that would be a way, to ensure that we get paid. And so to sort of spread the cost around. So that was the idea. In other words, they kind of had the sense that someone's going to, out of the population, a certain person's going to get sick, and it could have happened to anybody, but it's going to happen to this family during Depression. That's particularly an acute problem. And so they really realized, okay, the only way we're going to get paid now is if we lobby for health insurance. And so they would go to the government and try to get special privileges for that, things like tax exemption status and whatnot, so people could pay for health insurance with pre-tax dollars, things of that nature. But the government did just give those favors for free. They would say things like, okay, well, you got to have community rating then, meaning, you got to make it so that you charge standard premiums based on just a few characteristics, and you don't get really specific about someone's medical history. So it was in the Depression and shortly thereafter where you saw the rise of, the big Blue Cross and Blue Shield, which were originally organizations designed to, to make sure that they were like fostering for hospitals and doctors to make sure they could get paid. So that's where you started to see the institutionalization of it. So again, it was primarily, I think, an outgrowth of it was an artifact of the Great Depression that probably, if there hadn't been this decade-long depression where there were a lot of people who needed medical care and couldn't afford it, you might have seen a lot of these trends, playing out much more slowly.
Okay, and then shortly after that, the onset of World War II came, and the institution of wage and price controls in the U.S. So can you talk about the significance of those wage and price controls during World War II and how we're still seeing the after effects of that even today?
Well, sure. Great question. So here, again, we sort of take this for granted. Let's just step back for a minute, your listeners, and think about why this is very odd, the situation we were in and what made people clamor for Obamacare or the Affordable Care Act. It was that people's health insurance, for some reason, was very often tied to their job, to their employer, and such that, if you had a good job, you probably had a good health insurance, but if you lost your job, you could be in trouble. And what would really be bad is if you had a condition, you were getting treated for something serious while you were employed. And then what if you lost your job and had to get another job? And then there'd be that issue of, would someone want to hire you knowing you'd have all these medical expenses? So that it raises the question, why is it that health insurance is so different? Because again, your car insurance, it's not like someone says, oh, you know what, I can't drive because I lost my job, and so I lost my auto insurance. So now I can't drive an uninsured vehicle. No one would even talk like that. That would sound crazy. Your car insurance has nothing to do, or the fire insurance on your house has nothing to do with your employer. So why is it historically that Americans tended to have their health insurance paid by their employer? And so, as you say, one major factor here that really amplified that trend was during World War II. So the government's spending a lot of money, borrowing a lot of money for the war effort. And one of the things they did was they turned to inflation. So the Federal Reserve would create a bunch of money to then go buy bonds issued by the Treasury to cover these huge deficits to finance the war effort. So if they just sat back and did nothing, that would have caused massive price inflation, right? All the extra money that the Federal Reserve created in order to finance the war would have pushed up the prices of bread and nylon stockings and so forth. And so what the government did to combat that is they imposed wage and price controls. They had schedules saying it's illegal to raise wages more than such and such per time period. So now you've got employers who are scrambling to try to attract qualified employees, and it's illegal for them to offer more money. So what did they do? So it was actually in 1943, the War Labor Board issued a ruling to say employers, they can't offer more explicit wages or salaries, but what they can do is pay health insurance premiums, and so that's not going to be considered part of the total compensation package. That's not going to violate the prohibition on, increasing the pay of workers to try to contain price inflation. So that was, so if you're not allowed to offer more money, the way you can attract qualified employees from somewhere else is to say, hey, we offer very generous health insurance coverage. If you come work for us, that's just one of the perks of the job. And that skirted the regulation. So that was a major factor in how it became so standard that part of what you got if you went to work for a major corporation for your quote real job in life was that it was pretty standard. You'd get health coverage for you and your family. And then even after the war, that was sort of grandfathered in, or that trend continued because of the tax code. And that's true to this day, where if your employer gives you $100,000 in just salary, then that's all taxable income to you, the employee. But if instead your employer gives you $90,000 in salary and then on the side pays $10,000 annually for health coverage for you and your family, you're only getting taxed on the $90,000 that you report to the IRS as your wages or your salary. That $10,000 is not taxable income to you, even though the employer still gets to write it off as a business expense. So that's a huge incentive in the current tax code that makes it, that gives an incentive for employers to give you health coverage rather than paying you the same dollar amount and you go buy it yourself. So there's reasons for why that's there, but given that it's there, it kind of explains part of the mess we're in, where people aren't buying their own health insurance. It's all done by third parties.
So how did later the creation of Medicare and Medicaid affect the healthcare industry?
Well, it just institutionalized, moved millions of people onto literally being on the rolls of the government in terms of paying for healthcare, and so it went from, if it were just Medicaid, that would be one thing, because you'd say, okay, yeah, if people can't afford it, or there's some the widows or whatever, people people want to take care of, and it's more of an explicitly designed welfare means tested program. That's more understandable why Americans would want that. But Medicare, where it's just, even if you're making $250,000 a year during your career, you certainly could have the ability to finance your own long-term care. Instead, that it's just assumed that no, once you hit a certain age, 65 or whatever it is going to be, that now all of a sudden the federal government's going to pick up the tab of your health coverage. So a few things. I mean, one obvious thing is just in terms of setting up that political institutional struggle there, that it's once you had that in place, it was really hard to get, it's to this day, it's hard to get rid of. And I got this huge voting block, especially retired people are very politically active because they have a lot of free time. They're not driving kids to soccer practice or going to work. And so they can research the issues and whatever. And so politicians have known, that's like considered a third rail in politics. You don't touch with those programs for old age people just because they're so politically powerful. And they have a lot of money too, because they've been saving their whole lives. So it set up this huge voting block to make it hard to get rid of that entitlement. But also that's part of the reason that healthcare costs escalated so much and that the quality of care suffered, is that now, just in general, instead of everyone going to the car dealers and buying their own cars, what if we all just paid into some giant pot and then had the government be in charge of buying our cars and then delivering to them, to us? That would be a crazy system. It would cost a lot more, and we would all be less happy with the cars we ended up with if all the money was funneled through Washington and then came right back to us. And yet that's the system we've somehow decided upon by which people who are retired get their medical care. It's a crazy system once you sit back and think about what it's doing.
So before we move on to Obamacare and sort of the nuts and bolts of that, I want to ask you about a topic that's very much related to Medicare and Medicaid, and that's sort of the destruction of the price system in the healthcare industry. So what's the significance of the absence or destruction of the price system in that area, and are there any other major events that help bring that about?
Sure. So the big picture here is, and John Goodman, who's an economist, he was at the National Center for Policy Analysis, and then I think he's got a book with the Independent Institute, and it's called Priceless. And so, of course, it's a play on words. It's like whatever that credit card company was. I forget which one now, with their ad campaign. But
MasterCard, I think.
Yeah. And so I'm not getting a plug, a kickback from them. This isn't a plug for MasterCard. But, it's partly why he chose that title, but it was also to show that the problem, in his view, like the problems in one word of the U.S. healthcare system. Why is it that free market capitalism and the advances we see doesn't seem to be working, at least in certain pockets in the healthcare system? And he said it's because it's priceless, by which he meant there aren't market prices allowed to do their job. And saying when you go, like right now, if you go to see your doctor and he says, "Oh, geez, you know what? You got something, I got something here. This is outside my, let me write you up a thing here. Now you go see this specialist." And you go, it's not like you go shop around. It wouldn't be like if somebody said, "You know what, you need this part for your car." You might go shop around for it. Or somebody said, you need to get a new car. This car's breaking down. It's not like the person would, your mechanic would write you a slip of paper, then you go buy the exact car he just told you to go buy for whatever price the dealer wanted to charge you. That would be insane. That's not at all how it works. But yet that's how it works with medicine right now. And so, people do not have an incentive to shop around. It's because they don't feel like it's real money, right? If you go to the hospital for something and you leave after 2 days and you look at the bill and it's an itemized thing and it could be $40,000 or something, but yet you don't think of that as real money because oh, thank goodness I have insurance. The insurance is good. Or the insurance, makes them cut the prices all in half, and then they pay a big chunk of the difference and so on. So that's the point, that we've gotten to this point where the patients, the actual recipients getting the product, the health services, they are not directly paying for it. In fact, they're considered a nuisance, right? The doctor doesn't look at you in a typical case as the paying customer. You're just someone who's there that, because of the way the thing is, the doctor has to perform certain services, but ultimately the doctor is either working for the government if you're a Medicare patient or Medicaid, or the doctor is working for the health insurer because they're the ones actually sending the money. They're the ones calling the shots and saying, you got to run through these tests. So a lot of the craziness in the modern healthcare delivery system, to a first approximation, when you say what's causing this, it is that right there, that the fact that the people getting the care, I mean, of course you're paying for it indirectly with your healthcare premiums or the amount you kick in for your Medicare payments throughout your lifetime in terms of your paycheck being deducted. But in terms of directly on the spot, if you realize, wait a minute, this hospital would charge me such and such. If I go down the street to a different hospital, I can save $300 for the same procedure. Nobody thinks like that because they don't get to keep the money anyway. So why would you? And so there was a story where a woman was pregnant and she just wanted to find out how much, if I have a healthy, not C-section, just, regular birth and so forth, what's that going to cost me? And she called around to like 8 hospitals in her area, and only one of them would even give her a number. The other 7, I'm not sure, it might not have been 7, but it was only one would actually even give her a number. The rest wouldn't even tell her how much it would be. So, I mean, that's a very strange system where you don't even know what the price is before you're forced to buy something.
So what are the main features of the Affordable Care Act, and how is it transforming the healthcare system?
Okay, sure. So here, there obviously are, if you went and read the actual bill and so forth, there's thousands of particulars. Why would you do that? Even the people voting on it didn't do that, right? But
and then all the regulations that cabinet secretaries write on top of it.
Right, exactly. The actual applicable things literally weren't even in the bill, that they had to be decided after the fact. But as far as like the main features, it actually made internal sense. Like it had to be like that, and it followed what the economist Ludwig von Mises often talked about, saying you can't just have a one-off intervention. That when the government dabbles in one area to try to fix something that people don't like about the market outcome, it sets up unintended consequences, and then the government has to keep playing whack-a-mole, just intervening more and more until we move towards full-blown socialism, or they need to pull back and go towards a market economy that you can't really hang out halfway in between the two extremes, because that's an outcome that nobody likes. So as far as this goes, the overarching problem was that there were millions of Americans who did not have health coverage, and given how expensive medical care had become for even standard procedures, it got to it's catch-22 where you needed to have health insurance to be able to afford health care. But yet now premiums were so high because the health insurance was paying so much that people couldn't afford that. So you had this crazy system like that, and especially with people with pre-existing conditions, some of them just were denied coverage. So that was the thing a lot of Americans didn't like, and that was why the public would supported the Affordable Care Act. But if the government had just said, okay, from now on, it is illegal for a health insurance company to deny an application. So if somebody applies for coverage on one of your kind of policies, you as a health insurance company operating in America, you have to give the person coverage. If that's the only thing that the Affordable Care Act said, it'd be one page long, everyone could have complied with it and it would have been a farce, because then the health insurance companies would have said, okay, sure thing. And so, Jim Smith comes up to us, he's got a brain tumor, he applies for coverage. We'll grant it to him. Say, yep, you've got health coverage from us, and we're going to cap the total payments we'll make to you to $1,000 a year. There you go, Jim. We just gave you coverage. That would be a farce, right? Everyone would say, oh, come on, that's not what we meant when we said give health coverage. We meant give good health coverage. So that's why they have what's called the essential benefits aspect of Obamacare, meaning that they set minimums and say, plans that satisfy this law have to have the following characteristics. They have to cover heart, blah, blah, blah. And that's why you get some absurdities, like my health plan right now, if I get pregnant, I'm covered, right? Because they have a standard, even though obviously in reality that's not going to be an issue. So, but you're not allowed to do that. You have to have very generic one-size-fits-all policies. But even that, if they just did that and stopped, that wouldn't have been enough, because now the health insurance companies would have responded and reacted strategically to that, and they would have said, okay, if Jim Smith comes and applies, we have to give him a very a generous package, good health plan, and we'll charge you $2 million a year in premiums. Okay, and so Jim Smith wouldn't have been able to afford it. And they said, hey, we didn't deny him coverage. There you go, but we're charging him $2 million. He didn't want it. You go, that's not our fault. So that's now the aspect of what's called community rating that was, built into Obamacare, saying the insurance companies have to charge the same price. They're only allowed to vary the premium except according to like geography, age, smoking status, and I think that's it. I mean, there might have been one other thing. And even there's only certain ranges. So, for example, for a given geographical region, someone who's really old can only have 3 times the premium as someone who's young, right? So the most the premiums can range. So it's not that the legislation mandates the dollar amount of the premium. It's just saying whatever you charge to like a young, healthy person, the most you can do is triple that when you charge, somebody who's 85 and, on his deathbed applying for the same type of coverage. So whereas before in the free market or the marketplace, it wasn't a free market, the range is more like 5 to 1. So even there, it's constricting their options. Okay, so you got that. But even if they did all that and sort of boxed in the health insurance companies, if that's all they had done, that also wouldn't have worked, because what would happen is sick people, of course, would have flocked and signed up for health coverage, and they would have gotten these great policies because of the minimum essential benefits, and the prices would have been, charged uniformly for everybody in the risk pool. But then the premiums would have been really high, and so healthy people would have dropped out and said, "This is crazy. I'm not going to get health insurance if it's this expensive. I'll take my chances." And so over time, you would have had an adverse selection problem where only sick people were applying for health coverage. And so the insurance companies, to stay in business, would have had to keep raising premiums so they'd at least break even. And eventually it just wouldn't work, that the premiums would be so expensive, nobody could afford it. And so the act would have quickly eradicated private health coverage, and people would have said, wait a minute, that's a mistake. You can't just bankrupt all the companies. So that's why they had to have the individual mandate, right? Because on the face of it, it seems odd that, progressive liberals would come in and force young people to go buy health coverage, but that was an essential, that was necessary given what else they were trying to do. If they didn't force young, healthy people to buy into it, the system wouldn't have worked, right? So you need all those healthy young people in the mix to keep down the average cost of insuring somebody from the health insurer's point of view, so that you can keep premiums to an affordable level. And so that's why you had that aspect. And then the last thing was and given now that you're going to mandate individuals have to buy health insurance, well, what happens if somebody's poor, right? Part of the reason originally so many people were uninsured, it wasn't just that certain people had heart conditions or something. It was some people just couldn't afford it. And so now you're going to, on top of it, fine them or punish them in some way if they can't afford health coverage. How's that helping? So that's why they had these huge taxes on the wealthy, as they say, and then, subsidize the poor, like to make it feasible or fair to mandate everybody gets health coverage with certain exception. So those are the main elements. So you can see as I walk through there, they couldn't have just stopped at step one. All of these features of what we think of as Obamacare were kind of a package deal once they made the fateful decision that, it's unacceptable that some people in this country can't get health coverage. And instead of us just like having the government pay for them, we're instead going to try to do something, to start making mandates. You can see how it ended up in this system.
Well, and even with all those features, there's still issues with rising premiums, with the quality of care declining, with rationing of care. Just how big are all of those problems, even with all those features and even with all those sort of self-corrections that they tried to build into this system?
Well, sure. So here, so thus far I was just started talking in generalities, but when you start looking at the numbers, yeah, I mean, it's just not working. I mean, already something like half of the Obamacare co-ops, like state-based things that were formed in order to help get people coverage have just gone under. You've got major health insurers either pulling out explicitly or saying, we're going to give it another year and we're not sure whether we're going to participate in these markets anymore. So the numbers just aren't working because there's a few things. So one is why there has been uncertainty and why the effects haven't fully kicked in yet is that, for one thing, some of these mandates they kept postponing, like the employer mandate, they pushed that back twice. Another aspect is the individual mandate. That started out very modestly because this stuff was very crafty the way they did it. They gave all the goodies up front, and then the sticks came down the road. So they got everyone who would benefit from it to get that up front, so they'd build a constituency, and then only later were the people going to see, wait a minute, this is actually not all we bargained for. But at that point, the thing would have been in place for several years. So it wasn't clear. Like the numbers didn't work the first few years in terms of viability of these plans. But part of it was insurers thought, okay, we're not going to jack premiums up too much because the individual mandate, the penalties on people who don't have health insurance, that hasn't, this year is the first year that's fully kicked in terms of the max level. And so they were saying, well, let's just wait and see how many people eventually sign up because maybe we won't have to raise premiums too much. So there's that uncertainty. And then also there was a cost sharing element where the federal government was basically acting as a giant reinsurer for the nation's private health companies, saying, don't worry the first few years if you have huge losses, meaning like in retrospect you charge premiums that were too low given the claims people submitted to you in terms of their medical expenses that you had to reimburse. We, the federal government, will split a lot of those costs with you, according to some formula. And so, and then it was only recently that the government actually kind of went back on that deal and said, no, we're not paying that stuff. They gave a lot less reimbursement than the health insurance companies thought they were getting. And that was, I think, part of the reason some of these major companies are saying, whoa, we're not sure we want to be in these markets anymore. So what I'm saying is, even though we have observed increases in premiums, and in the book I grabbed one study that looked pretty reputable, like it wasn't a person with an axe to grind against Obama, and they were doing a pretty sophisticated econometric thing, comparing apples to apples and looking at the pre-existing trends because premiums had been rising anyway before Obamacare, and trying to isolate the effect. And it was something like the premiums were 20% higher than you would have otherwise thought or expected. Right. So, but what I'm saying is even that masks the true impact of that because there were a lot of things holding down how much the premiums would have risen if it were just the full impact of the ACA without all of these like measures to sort of cushion the blow, like the government splitting costs and the insurers believing that maybe down the road more healthy people are going to sign up for our policies because the government's forcing them to. So I think we still haven't seen the full impact of it. If I could just give you guys one example for your listeners to know like what kinds of things do we mean and why I think this is just going to keep deteriorating in terms of the main system. Yes, they can control for certain things, the legislation, the government, the regulators. So if somebody explicitly denies a policy to somebody who has cancer, that's illegal and you get in trouble. But what they can do is stuff like this. If you're running an insurance company in a certain area, you're offering policies to people, you can say, hey, you know what? Go around our area and you figure out who are the best cancer doctors in this area. And so people can figure that out and say, okay, now let's make sure we design our plans, our bronze plan or whatever, so that the best cancer doctors are out of network. Because you want to make sure somebody who actually has cancer and is now legally, you can't stop them from getting you to give them a policy. You don't want them getting your policy. You want them going somewhere else. So there's all sorts of ways health insurance companies can, make them not attractive and try to deter people they really don't want as customers, even though it's illegal to just flatly refuse. And so it's this crazy system now where you've got millions of people that are being, forced to interact with companies that don't want them as clients. And so, of course, you're going to see the quality of customer service and other things go down in that system. And what's going to happen, I predict, is people are going to realize after a few years of this is terrible. This isn't working. And some politicians will say, yeah, it's because we got these stupid private health companies in the way. Let's just move towards single payer.
And that is a really good lead into the next question, which would be, do you think that is really where we're going? And how do single payer systems in different countries like in Canada and the United Kingdom work? And how are they better or worse?
Sure. So, yeah, and again, I'm sure most of your listeners know, but so what we mean by single payer is that all of the so right now there's multiple levels of payer. So the U.S. government pays a lot of for healthcare for people, especially when you consider Medicare and so on. And I've seen some projections that in the not too distant future, it might be up to 40% of Americans in some way are getting their medical coverage paid for by the government. But in a single payer system, it's just explicit that no, by definition, all medical expenses are run through the government. And I definitely think that's in the future. I mean, I think it might unfold over time, but I think that's the logical endpoint of this because, again, the way the current system is structured, people are not going to be happy. I mean, I've just noticed my health insurance has gotten easily 50% more expensive. And now when I call up like just to get somebody on the phone, it takes forever. And again, because it's their incentives that now at this point, people are forced to buy a product, and a lot of those customers, they don't want as customers anyway. And so how is the health company, insurance company going to deal with that? Well, they can do things like, not have as many people working the phones when a customer calls in, right? Because it's not illegal to make people wait an extra 10 minutes on the phone waiting for an operator. So things like that, the way they can contain cost, yet it's still in terms of customer satisfaction going to go down. So I think that's definitely the case. And you see, there are in the book, we have a long quotation. Harry Reid was doing some interview for like a public access thing after this passed. And people were saying, oh, so do you like the present system? And he was, no, this is just, he was basically admitting that this was just a temporary stopgap measure, and that ultimately, we'd get rid of this anachronism that we have in the U.S. of private companies getting in between doctors and people wanting medical care, and let's just have the government deal with it. So as far as your other question about, you get the version of it. It seems like you guys are warning about this, but in Europe and stuff, don't they have different systems? There are different models in different places in the world, right? So some places, like the government guarantees people coverage, and you can go and get government coverage. But there's also like a side-by-side private system. So those systems, I think, work a lot better because there's ultimately an escape hatch, and you do have some competition, to sort of keep a minimum level of quality. But I think another element of this is right now the U.S. acts as like an escape valve, right? So, for example, take Canada. There are several studies that would show the wait time for standard procedures in Canada is a lot longer than it is in the United States. But what I'm saying, but people say, oh yeah, but I know people in Canada, and they might tell me some horror stories about their Uncle Jim or something. But it's not like the people in Canada are all keeling over dying every day. So how bad could it be? Well, part of it is because people in Canada, when they know they're on a long wait list for a hip replacement or something, they can just go into the United States and get it. So I think people aren't fully, and the same thing with Europe, that people aren't fully taking into account that part of why these other places seem to be doing so is that the U.S. is this huge area where there is at least some semblance of a market where if you come here and you have a bunch of money, you can certainly get care. And so that's, I think, one thing throwing a lot of those statistics. So again, there's a lot, it's hard to make blanket statements about the rest of the world, but I think a lot of the studies, when you look at, like the availability, like MRI machines per capita, things like that, you can see a lot of these places that some progressives are holding up as the mecca of socialized medicine that actually, if you were to generalize that, then it wouldn't work. It's just that, they can kind of get by because other people, have those specialized treatments that people in their country who need it can go abroad.
All right. So one more question before we start wrapping up here, and that would be, what the solution to all this is and what a true free market healthcare system might look like in 2016.
Okay, sure. A great question. As opposed to just complaining about everything, what do we have to say about it?
Right.
So my co-author Doug McGuff and I, we're both big on the free market, and we think that in terms of general principles, that the same thing that when it comes to computers or automobiles, you can see how if the government took that over and everything was administered through Washington and there are all sorts of regulations and so on, that the quality of the product would go down and the prices would go up, and you would kill efficiency and so on. And so we're saying it's the same thing with the delivery of healthcare, that you want to unleash all these millions of doctors and nurses and so on and entrepreneurs to come in and figure out different ways to deliver care. I mean, just look at like things like, getting LASIK surgery, eye surgery, cosmetic surgery, things that are more considered optional, and that you just kind of go. I mean, you can go to the mall and just out of pocket pay for something to go get those things, and that the prices of those have come down. It's like the computer sector, but it's rather But in terms of medicine, like going to a standard hospital and just getting your tonsils out, for some reason that hasn't become ridiculously cheap. That's become ridiculously expensive, and so you're trying to figure out. It's not medical care per se. It's medical care that's being handled in this bureaucratic third-party payer system where the prices have gone up. Whereas if you're just paying out of pocket for things, there you see the normal innovation of the market. So we're just trying to come up with recommendations for how do we transition so everything has the same success as these other areas that are sort of just vanity procedures, and yet the prices have been coming down. So one huge thing we say is the FDA, the Food and Drug Administration, in terms of inflating the cost of where we think people are using too many prescription drugs in general, but in terms of why are those things so expensive? Well, the FDA is the obvious problem there. And so a simple recommendation we give is to say, look, if you're somebody who's concerned about quack pharmaceutical companies selling you some product that's not safe, you can still have the FDA give its opinion on various things. And if you want to say, I refuse to use a drug that doesn't have FDA approval, then you can still do that. But if there's somebody else who says, I don't care what the people at the FDA say, I read these private watchdog groups, I have my own doctor who I trust or whatever, and I want to try this particular drug, then who's the FDA to come in and say I can't do that? And so that's one obvious thing is we think turn the FDA so it doesn't have mandatory coercive power, but at best is just issuing its opinion on things. And if consumers want to use them as an authoritative source, they can. So if you did that, a lot of the prices and for certain things would plummet overnight. So that's one obvious example. And the AMA, the various licensing for who can practice medicine. Again, we think that should be greatly relaxed. If people are worried about quacks, again, you can still have the current existing licensing boards have a database of people they approve of. And so if you say, I only want to work with people that my state legislature through their board has certified, you can still do that. But the point is if somebody else opens up and people are going to him and he's providing good care and he's got happy customers and he charges 1/10 of what everybody else charges, that the government shouldn't come in and make it illegal for people to go to that guy. So those are just, to get these institutional roadblocks out of the way and just allow more entrepreneurship and freedom, we think we would see the explosion of different product offerings at lower prices, and that would do a lot. I mean, that would solve most of the problem right there, because that's part of the issue. The reason people think they need health insurance is because just to pay out of pocket for standard procedures now is unaffordable for most people. So if you brought those prices way down, whether you had health insurance or not, that would no longer be such a critical matter.
Okay. Thank you very much. How can our listeners get more of Bob Murphy? I would encourage people to go to my website, consultingbyrpm.com. So consultingbyrpm.com. That's sort of like the clearinghouse where I just give links to everything in there. You can get into all the things. And the podcast, it's pretty entertaining. ContraKrugman.com, where Tom Woods and I take on Paul Krugman's weekly column and use it as a springboard to teach economics.
Well, great. Yeah, I highly recommend our listeners check out Contra Krugman. And I also highly recommend everyone check out the Primal Prescription. It's well worth your time. And I just want to remind everybody that the show notes page for this episode is at wakeupcallpodcast.com/healthcare. So thank you once again for joining us. And
yes,
hopefully we can have you back on again in the future.
Thanks so much, guys.
All right. Thank you.
Thank you for listening to this episode of the Wake Up Call podcast.
If you would like to listen to more episodes, please subscribe, rate, and review the show on iTunes or subscribe on Stitcher. And check out our website at wakeupcallpodcast.com.
There you will find show notes pages and comment sections dedicated to the show. You can also email us at contact@wakeupcallpodcast.com if you're interested in being interviewed for the show or have any other suggestions.
Thank you.